Hi, Stuart Roseler here again from the LBG Medical Customised Lab. Today we're going to talk about something that is relatively simple but can be one of the things that is very misunderstood out there. Heel heights and heel widths, okay, and how they relate to each other. So when we're talking about specifying a heel height, the lab does do a lot of different things by a standard. They're various across device, and it's worth having a look at our manual internally to get your mind around what the different heights are. But they range essentially from 6mm for an ultra low bulk up to whatever you need in a height. But please remember that when you're selecting heel heights, the shape of the foot, the width of the device, and the capacity for that material to go up to that area, it needs to be considered. Okay, so when we're talking about a heel height and a heel cup, okay, essentially we're talking about a curved surface of the heel. So if you think about we're looking for the height will be determined by how wide you go around that curved surface. Okay, so the further we go out, you can see that if we truly follow the foot, we will get a higher or a wider heel cup. Okay, so a lot of the problems that we occur in the width is a heel height has been specified. We try to hit that exactly, but then the width has been either widened or narrowed according to the anatomy of the foot and the heel. So we want to do exactly what it is you want, but there's an interpretation there. More often than not, when I ask the technician what goes on, is they'll try and meet the best thing. What I want them to do is call you. Okay, and we can talk about the heights from there. The purpose of a heel and a heel cup is essentially to contain the heel. So another one that tends to get lost in the mix is the tissue expansion that can occur. And we all know those patients that we get out there that when we see the heel touches the ground, some expand a lot and some don't expand too much. So when we say a 3mm addition, okay, to a heel expansion, that means we put 3mm of plaster onto the casted shape of the foot. It'll expand it out. You can see that this will affect not only the heel height, okay, but the heel width. Right. So when you're trying to get that fit to the shoe, which is all important, please relate it to the foot that you're seeing, because what we're trying to do in heel cups and heel heights is two things: contain it to the shoe that the patient's using and control the back of the foot. So you can see something so simple can get so complicated. Welcome to the world of orthotics. Look forward to seeing you soon, and we'll talk about more or any other requests that you need for videos into the future. Thanks for your time.